प्रिय दर्शकों, श्रीमन अस्पताल की तरफ से मैं डॉक्टर वीपी शर्मा आपका हार्दिक स्वागत करता हूं। श्रीमन अस्पताल की तरफ से एक नया प्रयास शुरू कर रहे हैं जिसमें हमारे माहिर डॉक्टर आपको इन बीमारियों के बारे में जानकारी देंगे तथा यह भी बताएंगे कि समय पर रहते हुए आप इन बीमारियों से कैसे अपना बचाव कर सकते हैं और शुरू में ही इन बीमारियों को पहचान के अपना समय पे इलाज करा के एक लंबा निरोगी जीवन व्यतीत कर सकते हैं।
Hi viewers, good morning, welcome again. Me, Dr. Ajay Marwha, a nephrologist from Shriman Super Specialty Hospital, Jalandhar, Punjab, India, once again is with you. Previously, I have discussed with you regarding kidney diseases, what are the causes of kidney diseases, what are the symptoms of kidney diseases, and how to investigate about the kidney diseases, what are the tests available. So now I will be today discussing about the treatment modalities, how to prevent the kidney diseases and what are the treatment modalities available for the kidney diseases. Before coming to the prevention and treatment modalities, I will just briefly sum up the previous discussion that we have discussed. The cause of kidney disease, most commonest cause which I have discussed initially was the diabetes, then comes the hypertensions, infections, unauthorized use or excessive use of the painkillers, over-the-counter drugs, and certain hereditary disorders which are associated with kidney diseases. And then we have discussed what are the most commonest signs and symptoms is the swelling over the body, decreased urine output, frothy urine, decreased appetite, dyspnea. These are the common symptoms which a person develops. Because mostly the kidney diseases are the silent diseases. They only manifest once the disease has progressed to advanced stage in most of the persons. Now, what are the easiest mode to check or to detect the kidney diseases is simple. You get the urine examination done or the simple lab test called the blood urea or serum creatinine level done. Now today I will be discussing with you the prevention and treatment modalities of kidney diseases. Once you have such symptoms like swelling of the body or decreased urine output or the pain abdomen, or with the previous history of stone disease, that kidney stones are there, you should follow or you should show to your respective physicians, and if they found they have underlying some disturbances in the blood parameters which pertains towards the kidney diseases, which points toward the kidney diseases, you should contact your nearest kidney specialist so that he can further look into the cause and start the treatment. As a medically, we divide the kidney diseases into 5 stages depending upon the kidney function. Stage 1, 2, 3, 4 and 5. I will not go into details what are the stages. These are basically the medically one, but once stage 1 and 2 are the one which normally patient does not present. It is only the stage 3, 4 and 5 when the kidney. Stage 3 means the kidney functions, it goes less than 60 ml per minute per 1 square meter square. It is GFR which is one which we calculate depending upon the serum creatinine and the person's body weight. So once we develop the symptoms, we should be visiting our nearest nephrologist and follow the advice of the nephrologist. Basically, what are the broad basic treatment modalities which are available for kidney diseases? One is the medical management. The time at which patients can be treated or prevented the progression of kidney disease. I tell you, once the patient develops a kidney disease and we label them as having a chronic kidney disease, it is always a progressive disease. Disease progresses slowly and slowly in the body from one stage to another stage, and a stage comes called a stage 5 when the person will require dialysis or a renal replacement therapy. So what are the treatment modalities available for every kidney patient? The stage where he requires the medical therapy in terms of the drugs, then stage comes when he requires a renal replacement therapy. That is, either he goes for a dialysis or a renal transplant. So what do you mean by a dialysis? The term dialysis in a public domain, it sounds very large once you tell them that you will require a dialysis. Most of the patients, even the families, they goes into a back foot stage. They becomes whatever. This is a horrible term, dialysis. I assure you, dialysis is not a horrible term. It is a life to patients who have a chronic kidney disease. It gives another life. Basically, dialysis removes the impurities of your body artificially. Now, the dialysis are available of two parts. One is called a hemodialysis. Second is called the peritoneal dialysis. So, what do you mean by hemodialysis? Hemodialysis is the one, in the layman terms, blood comes out of the body, goes to an artificial kidney, which is made up of a plastic tubing and plastic fibers, medicated, and it returns back to the body. That artificial kidney takes some part of your kidney functions, it removes the impurities so that the blood goes back in the pure form into the body. In this whole process, we usually don't require any kind of blood transfusions, nothing else. It is 4 hours process, 3 times in a week. So total duration of therapy is roughly 12 hours in a week. So this is called a hemodialysis. For a hemodialysis, every patient, they have to visit to a nearest hemodialysis centers. Now recently we have a home hemodialysis. Those who can afford can have their dialysis unit set up, that machine set up at home, and he can do a hemodialysis himself or with assistance of a dialysis nurse at the home. So this is one part called a hemodialysis. Another modality available is called a peritoneal dialysis. In this case, a small tubing is fit into the abdomen. One end is into the abdomen part, another end is outside. Special medicated fluid comes. We insert the fluid into the abdomen. It is kept for 6 to 8 hours, and then it is taken out after 6 to 8 hours depending upon the patient to patient. So in this case, peritoneal dialysis can be done at home with himself or with the assistance. Does not require any blood to come out of the body. Here the fluid or the medicated fluid which is inserted into the abdomen, it works for that we take out the impurities from the blood, and we take out the impure fluid after 6 to 8 hours and reinsert the new medicated fluid. It can be done at home or patient himself. Does not require any hospital visit every week. Here he can visit the hospital once in a month for a regular checkup. So two modalities, one hemodialysis, second is called peritoneal dialysis. Third modality available is the transplantation. Renal transplantation is the one in which the human organ, the human kidney, is inserted into the patient, who can donate for the kidney? It is, as per the law, it has to be in the blood relations with a blood group matching, or now recently we can go for a unmatched blood group also, called ABO incompatible transplants. This has recently come up. So the three modalities available: one is the dialysis, second is peritoneal dialysis, third a renal transplantation. These are the three modalities available for a person who is having a kidney disease stage 5, when the kidneys are gone, having a fluid symptoms. Before going to transplantation or before going to renal replacement therapy, once the symptoms are less, and secondly the blood parameters are not so bad, he can be managed with the drugs for the time period. Like if he is depending upon the underlying cause of kidney disease, if he is diabetic, we have to control the blood sugar, we have to control the blood pressure if he is hypertensive. So these three modalities has to be taken care, has to be opted one either peritoneal or hemo or transplant if a person develops an end stage renal disease. Now, these I have discussed with you broadly the methodologies or the treatment modalities available. Now, how to prevent kidney disease? This I have discussed. What is it once he has landed up into an end stage renal disease, when the kidneys are totally damaged? Now, how to prevent the kidney disease? This is the main. Once you have been affected the kidney disease, that's fine. Then you have to opt for the treatment. But what are the preventable modalities available so that we don't get the kidney diseases? So, what are the preventions? These are simple preventions which a person can opt in the day-to-day livings. If first most common prevention or most more preventable thing is that he has to be modified his lifestyle. Since I have discussed in the causes, most commonest cause is the diabetes. Normally it is becoming an epidemic, like it is growing day by day. The number of patients are becoming more diabetic. It's all depend upon your day-to-day food habits and your lifestyles. So we have to change our lifestyles. Do daily 1 hour exercise. You burnt out your fats, burn out your energy. So do a daily exercise, do a daily yoga, so that your lifestyle is modified. Your all other blood parameters are controlled. Blood pressure is controlled. Second most common cause was the uncontrolled take of painkillers, over-the-counter medications. Never take the over-the-counter medications. If you have to take any painkillers, anything, you should consult your doctor before getting these things. And once the doctor prescribes some medicine, it is prescribed for some days only. It cannot get lifelong. You keep on taking these painkillers and everything. So you have to follow the advice of a doctor regarding what are the painkillers he is advising you and for how long. Don't take it blindly that once you have started, take on lifelong, that the doctor has already given me the prescription of painkiller. Whenever I had a pain, I start taking these painkillers, irrespective of what the painkillers are doing in the body, they are causing, how much harm they are causing in the body. Third, smoking. Don't smoke. Smoking is one of the adding factor of the kidney diseases. Diabetics plus smokers, they cause much more harm, not only to the kidneys, they also affect the other organs of the body like the lungs, heart, brain. Blood vessels becomes thinned up, they start having the pain in the legs. So don't smoke. So what I have told you, how to prevent? You don't take the painkillers, you keep your body fit by following the yoga or the exercise. If you are diabetics, your blood sugar should be controlled. Follow your physicians regularly for a proper checkups. your diabetic status should be strictly controlled. All of you who are diabetics, they are aware that they should are having a 3 months checkup by HbA1c. It should be less than 7%. So the diabetic status should be strictly controlled. Most of the seen that patients or the public who become diabetic, once they visits a physician, they advises some tablets, he or she keep on taking that tablet or that medication without getting repeatedly checked up. So you don't take self medications. Once you are diabetic, you should regularly follow your nearest physician so that he is able to check you up properly, look into the side effect of diabetes which are not developing in the body. Blood pressure, again you take the proper medication of the drugs so that if blood pressure is properly controlled. Uncontrolled long-standing blood pressures, they causes the damage to the kidneys, your heart, your eyes, they are affected. So blood pressure is again regularly checked up and properly controlled. In a normal person, those who don't are having any of the diseases, they should take plenty of liquids, low salt diet, because excessive salt again can cause different problems in the body. So I have discussed with you today regarding the treatment modalities available for end-stage renal disease and how to prevent the kidney diseases. The next I will be coming up regarding I have not discussed that regarding transplantation, what is renal transplantations, what are the legal formalities, who can donate it is there, what are the post-transplant effects in the body. So in the coming next lecture, I will be discussing with you about the detail of the transplantations. Thank you. Bye bye. Any query regarding the kidney diseases, regarding the treatment modalities, you can call us, write us on our mail, on our phone numbers, which is given underline. Thank you. Bye bye.